Colburn.
Thank you, Madam Deputy Speaker. And in my short contribution as someone who used to work in the National Health Service, I would like to focus on the health challenges faced by men. And I think I'd like to focus on three primary areas in the short time I have available to me. The first is in relation to the current pandemic and coronavirus, with PHE's review demonstrating that despite making up only 46% of diagnosed cases, 60% of deaths are men and 70% of admissions to intensive care are men. And working age males that are diagnosed with COVID-19 are twice as likely to die. Now, I know that the Minister is continuing cross-departmental work to understand the risk factors associated with this disease, so I would hope that we continue to look into the reasons behind why this disparity exists. The second health risk I'd like to focus on is cancer. In men in the UK, prostate cancer is the most common cancer, and prostate cancer is the second most common cause of death, with around 12,000 deaths of prostate cancer in 2017. In addition, since the early 1990s, testicular cancer incidents have raised by nearly 24% among men in the UK. Now, I know that there has been great strides here. We've seen huge strides in survival rates, particularly among prostate cancer, from 76% of people dying within 10 years in the 70s to just 16% now. But there is still a lot more to do, and I know the NHS long-term plan has an ambitious cancer screening commitment, but this must also be coupled with work done to tackle the stigma around men's health, particularly around male cancers, and too many men leaving it too late before they seek help. But I think, as honourable members have already outlined, one of the most chilling statistics comes in the form of mental health and suicide, because it truly is a terrible thing that the single biggest cause of death in men under 45 in the United Kingdom is men taking their own life. Men account for about 3/4 of suicide deaths registered in England and Wales, and middle-aged men in the UK have the highest average suicide rate of any age group. Now, I again want to draw attention to the good work of the NHS long-term plan, which is working to design a new mental health strategy improvement programme which will focus on suicide prevention. Ministers say that reducing suicides remains an NHS priority, and I would urge them to ensure that that is the case, because it cannot be right for the most common cause of death for anyone of any age, gender, sexuality, race, religion or creed comes from them taking their own life. So I would urge the government to do all it can to make sure that these terrible health statistics are consigned to the dustbin of history as soon as possible.